Dr. Olusola, thanks for joining us again on Health Connection. Our topic, vaccines for the whole family. Back to school means making sure our kids' vaccines are up to date. What vaccines do we need to be worried about for kids?
For kids, there's several vaccines. For the school-aged requirements, they do require you to be up to date on tetanus, diphtheria, and pertussis vaccine, MMR, which is the measles, mumps, and rubella, polio vaccine. They'll need to be up to date on hepatitis A and B immunizations, I believe, and varicella vaccine, the chickenpox vaccine. Those are all required for school-aged kids.
There's been controversy in recent years with respect to children's vaccines. Why?
Well, there was a lot of initial concern that these vaccines may be causing or contributing to autism, ADHD, and other children's disorders that occur around the same time they start getting vaccinations. So autism, we normally start seeing it around 18 months to 2 years of age, which is when they receive a lot of vaccines, particularly associated, or what was thought to be associated with MMR. It's been proven in many studies that they are not associated with it, and disproven several times, although if you search the internet, that's the first thing that pops up, is vaccines related to those type of disorders.
As a result, some parents are refusing to vaccinate their kids, and there's some non-compliance with vaccination. What are the risks for children who don't get immunized?
The biggest risk for the children who are not immunized is that they themselves may become ill with these vaccines. We do occasionally see illnesses that are very rare in our vaccinated population, such as measles or mumps, chickenpox, things like that. We do see them every once in a while in children who've not been fully vaccinated, and that's the biggest risk to the child. The bigger risk to some of the population is that these children may pass the infection on to either younger children, infants, particularly those under the age of 2 months who haven't received any vaccines yet, or the elderly or immunocompromised.
We've been talking about children. Let's get a little older. Are there vaccines that teenagers need to have?
Yes, teenagers are required to have boosters of their tetanus, diphtheria and pertussis vaccine, the Tdap vaccine. They're also required to have a meningococcal vaccine. They're recommended to also have the human papillomavirus vaccine, both boys and girls, now, to prevent genital herpes as well as cervical cancer in girls.
Let's get a little older still. What about adults? What do we adults need to keep current?
Healthy adults need to stay current on their tetanus vaccine every 10 years. It's recommended. And now with the pertussis outbreaks that we're seeing, we're recommending that all adults have at least one adult pertussis booster, which can be combined with the tetanus booster. Also, all adults, all people above the age of 6 months, we do recommend get annual flu vaccines. So even healthy adults, we recommend getting the annual flu vaccine. The other thing, older adults over the age of 65, we recommend pneumococcal vaccinations, and even younger populations if they have chronic medical problems and diseases. If you're above the age of 60, you can get the varicella zoster vaccine to help prevent shingles.
Can the vaccines that we all got as kids wear off over time, lose their effectiveness?
Some can, and that's what we're seeing. That's what we believe we're seeing with the pertussis outbreaks, especially in California here this past year. It's been one of the worst years in several years. And we think a lot of it is due to the waning immunity seen in the adolescent and adult populations. That's why they recommend the booster now for teenagers as well as adults.
When I was young, everybody got a smallpox vaccination. Everybody had the little badge of having that done usually on their left bicep. What happened to that?
Well, that's the wonderful thing about vaccines, is that you can eliminate illnesses within the population, and smallpox has been eliminated as a what we call a wild type infection. The only infections that we've seen of smallpox have occurred in labs where people are working with the smallpox virus. So there's no longer a requirement for smallpox vaccination.
If my doctor doesn't recommend these vaccinations to me, should I bring it up myself? Should I ask?
Absolutely. In this day and age where we're very busy, we're trying to deal with multiple different, sometimes medical problems within one visit. Sometimes we forget to remind patients, have you had this done? When was the last time you've had, a tetanus booster and things like that. So absolutely bring it up to your physician.
Let's talk about the future just a little bit. What research is being done now on vaccines that will be in our hands in coming years?
I think some of the most exciting vaccines in the near future, probably in the next 5 or 10 years, are going to be vaccines that are mainly going to affect worldwide problems such as HIV, malaria, tuberculosis, those types of vaccines, which are really exciting to see some of the progress made in those areas.
Very well. Doctor, always a pleasure. Thanks for joining us.
Thank you.